everyone. Welcome to the Limia Hospital Instagram Live. And I'm Dr. Olaitan Alofe. And here with me is
Dr. Keshy. Yeah, good evening, everyone. It's nice to be here.
yes. And today we'll be talking about hepatitis, living with hepatitis in particular. Concerning everything you need to know about hepatitis, we'll be talking about how it's transmitted, diagnosis, how to manage it, and also prevention today. So all your questions will be answered.
So, we want to make it a very interesting session. We want everyone to participate. So, in the course of our presentation, if you have any questions, feel free to drop them in the comments or leave a comment for us. We'll see it and we'll respond as soon as possible. So, over to you, Dr. Alofe. Just tell us a little bit about why we're here and why we're discussing this today.
Okay, so today is actually World Hepatitis Day, and as a means of just celebrating that, that's why we're doing this information session. And every year, World Hepatitis Day is celebrated July 28th, and the theme of this year is One Life, One Liver.
Yes, so that's a very apt theme. I think it's quite an interesting theme, this theme for this year. One life, one liver. So, like we all know, liver is one organ that we do not have two of. We all have kidneys. So, where one is damaged, it takes a while, and then there's another one to augment. Someone can donate one of their kidneys and still function adequately on one kidney. However, for the liver, we have one liver, and everyone needs to be aware of that. So we know that we do our best to protect our livers and keep our livers in top shape. And so, World Hepatitis Day this year is focusing on one life, one liver. And so, every one of us needs to be very well informed of the fact that this is my one liver. Oh, I have to take care of it.
Definitely.
Yes. Okay.
Okay, so hepatitis does not just involve people in Nigeria. This is a worldwide problem, and a lot of people are actually suffering from hepatitis. Using data from WHO, about 354 million people actually in the world have hepatitis B or C infection.
Wow,
That's a whole lot.
That's a whole lot.
Yes.
A whole lot. 354 million. That's like over twice the population of Nigeria.
Definitely.
Worldwide is living with hepatitis B and C infection. And it's very, very important because, like we're seeing, over 90% of these cases are not even diagnosed. So even these numbers we have are grossly understated, because most people who live with hepatitis do not even know that they have the infection. And so that's a major problem because where we know the numbers, we're able to at least be able to control it effectively. But where we do not know, the risk of transmission, continued transmission is very high. And so it's very, very important that we have days like this in the year where we pause and we say, okay, this is what is happening, this is where it's at, this is where we want to take it to, and this is what we can do. These are the things that we can do to prevent it or to stop the spread. Okay.
Yes.
So we're still saying, I think we're talking about, okay.
Okay. So about 3 million people actually diagnose themselves with hepatitis every year, and actually 1 million people die annually from viral hepatitis. These figures are a lot, as we've said, and daily 3,000 people die from hepatitis. So if we can just think about it, let's take a pause, let's check, do we have hepatitis or not? It will actually prevent a lot of these deaths that we are actually seeing.
Yeah.
And it's said that every 30 seconds, someone dies from viral hepatitis.
Wow. That's a lot.
Yeah.
That's a lot.
Okay, so let's get into it. So what exactly is this hepatitis we're talking about?
So, well, basically, the word hepatitis is just anything that has to do with hepatis is relating to the liver. Okay, so when we say hepatologist, the liver doctor. When we say hepatic, we mean relating to the liver. So, itis is another little suffix that we add to words that tells us about inflammation. So, simply put, hepatitis, inflammation of the liver. So that's the basic thing that's happening in hepatitis. We're focusing a lot on viral causes of hepatitis, but that doesn't mean that that's all hepatitis is about. Anything that causes inflammation to the liver is termed hepatitis. So we have causes that range from the viral ones, which make up the majority of cases of hepatitis, to chemical causes of hepatitis, where toxins can cause it, alcohol can cause it, autoimmune diseases can cause hepatitis, and these are very common. They are getting more prevalent nowadays. Like I said earlier, the focus will still be on viral hepatitis. Why? Because, like we earlier said, the transmission of these infections is so high, it's going at a very rapid rate, and prevention is still the mainstay of
Definitely.
control. And so we'll focus on that. Generally, every year, the World Hepatitis Day focuses on these viral causes, these infectious causes of hepatitis, and how to control them so that we can bring down the prevalence of the disease.
Okay.
Okay, so yeah, so generally that is it. So it is hepatitis is inflammation of the liver tissue characterized by the destruction of a number of liver cells in the presence of inflammatory cells in the liver tissue. So it may be the causes may either be self-limiting. By self-limiting, we mean that it starts because the hepatitis begins and the body is able to control it, or it controls it on its own, or it resolves on its own, or in some cases we may need it may cause a chronic or lifelong infection. Okay, yes. So
So, how can hepatitis be transmitted? I'm sure you're asking that question. So, the various types of hepatitis are transmitted in various ways. So, yes. So, for the hepatitis A,
okay, so sorry, when going back to the causes of hepatitis, we mentioned that viral causes are the main causes. So we need to pause and mention that of the viral causes, there are five main hepatitis viruses. Okay, so hepatitis A, B, C, D, E. Very easy, very easy for us to know. Okay, so the A and the E are mostly fecal oral or transmitted in our food, in our water. Yes, and from person to person. They are less of a major public health concern to us than the B and C. Okay, hepatitis B, C, and D are transmitted through blood
body
and body
fluids.
fluids. Okay, so blood transfusions, sexual transmission, those are very important means of transmission of hepatitis B and hepatitis C. Hepatitis D is usually or is only found as a co-infection with hepatitis B. So it doesn't come on its own. It can also be called the Delta strain. So it's either you have hepatitis B on its own, or you have hepatitis B
Yeah,
with the Delta
yeah.
virus, which is hepatitis B
D.
and D. So it comes together usually. We hardly isolate it and talk about hepatitis D. So majorly, most of our discussion today will center on hepatitis B and
I see.
hepatitis C. Another reason why, or the major reason why, is that these two cause lifelong chronic infections. Well, they could cause an acute infection. They could cause a fulminant disease, which is a very severe form of acute disease that could lead to death very rapidly, or they could cause a chronic illness. Now, the chronic illness, in the chronic stage, there's a risk of progression to liver cirrhosis, which is a scarring disease involving the liver tissue, and liver cancer. Okay, so that was just a broad overview of the
Of the types.
five different hepatitis viruses that are of importance to us. So you were telling us about the transmission specifically for each of them.
Okay. So, as we said earlier, the hepatitis A is usually through the oral route. So that's contaminated food, contaminated water, basically. So A and E, that's how they're transmitted. Then for the B and C viruses, that is usually through the body fluids. So this is when someone that is infected actually spreads their body fluids to other people. So that includes through sharing of needles, sharps. It can even occur from a mother to a child
Yeah.
during delivery. Then also unprotected sexual intercourse is actually another route through which hepatitis B and C can actually be transmitted. For the D is usually associated with the B, as she earlier mentioned. So those are the ways they can be transmitted. So how can hepatitis actually be diagnosed?
Okay, yeah. So hepatitis diagnosis, of course, is both clinical and then laboratory. Speaking about the transmission briefly, also, it is very important that we know these methods of transmission. So when we understand how it is transmitted, it helps us to attack or to address how we can manage it, or how we can control the spread. So since we mentioned that A and E are transmitted through
Alright.
food, yes, food hygiene, of course, would now come into play. Now for the B and C, it now tells us about, specifically for C, blood products, blood and blood products. Now, where they are not well screened prior to transfusion, it puts the recipient of these
At
products at
risk.
high risk of developing hepatitis B and C. And so, always, whenever you or your ward or any member of your family is going to need a blood transfusions are life saving, and so of course, many people will need them at one point in their lives. So just insist that these screenings are done and that they are done well, and that you see results before your
Go
family
ahead.
member, yes, goes ahead to receive blood products. They are life saving, and no doubt one time or the other, some many people will need to receive blood. But just make sure that the screening process is thorough and that you see the results.
Yeah,
Okay.
that's
Yes.
important.
Okay.
Okay.
So the diagnosis now. So we said a clinical. So for generally in medicine, everything we diagnose, we do a clinical diagnosis. Then we do a laboratory diagnosis to support it. So we make our diagnosis when we hear the symptoms, or when we say, okay, the things that commonly may point to, well, a lot of the time, the symptoms that commonly present in hepatitis B, hepatitis C, are general non-specific symptoms that you may not directly attribute to them, like malaise. Malaise can be one of the commonest symptoms. The person just says, I just don't feel well, I haven't been feeling well for a very long time. And I have treated this, I have treated that, malaise, not just feeling right. Anorexia, that's a poor appetite. Okay, other things may diarrhea, vomiting, weight loss, jaundice. Usually, jaundice may not when we hear the liver, we may think jaundice should be one of the things that we should look out for. Oh, yeah, jaundice. A lot of cases, in fact, most of the cases of hepatitis may not come with jaundice ab initio. Jaundice may be later in the disease, or in the acute phase if the patient comes early enough,
Yeah.
or commoner in the hepatitis A, you may see jaundice.
Right.
But jaundice is there in some cases, or in the chronic stages of the disease. There may be abdominal pain. Um, yeah, and so on examination, we'll find some of these things. There may be an enlarged liver in some cases. There may be a shrunken liver. If it's already in the stage of cirrhosis, the liver size may
Be
reduce.
smaller.
Yeah, be smaller than what we would expect. Other things may be symptoms or signs of complications. Now, for example, if it's a chronic liver disease where there's an acute a patient is coming in decompensated chronic liver disease. You may have ascites, which is a swelling in the abdomen with fluid. You may have fluid in the limbs. You may have reversal of their sleep patterns, sleeping during the day, awake at night. Um, so many other things that may,
This other
yeah,
side.
yeah, those are usually in the later stages of the disease, but early may just be non-specific symptoms that you cannot directly attribute. So most of diagnosis is done eh, at screening. People who
Yeah.
just come for screening, okay, I wanted to, in fact, most of the patients I see who come with fresh infections say, I wanted to donate blood for my family member, and then
I
when I
found
went,
out.
they said they had hepatitis and I couldn't donate, and then so people who just go for their routine or regular medical, and that's why we always emphasize the importance of
Yes.
regularly doing your medical checks. You need to be checked. You need to go and do your checks as often as
That's possible.
possible, because um, those checks sometimes may pick up things that may have been there for a while and nobody knew, and just early enough for us to make a difference.
And they are life saving.
Yes, life saving.
Yes.
Okay, so what are other tests or other things that we do in the process of diagnosis?
Okay, so we can do some blood tests. So that's basically the screening, as we said, when you come to the hospital. So we can test this. Then, it's affecting the liver. So doing a liver function test is the next step.
Okay.
Once you find out, oh, someone has hepatitis, so you have to find out how is the liver functioning? How has this impacted the liver? So we go ahead and do liver function test. Then you can do further tests such as the viral load. So you need to know the amount of viruses the person actually has in them, usually. And this can help to even monitor the progress of the infection. Then also a
Yes.
panel can be done.
Yeah, so this viral load you speak of, so it tells us, okay, in every meal of the blood, how much of the virus is
Yeah.
there in simple
Quantify
terms.
it.
Yes, so it quantifies the virus. Now it informs our treatments. It informs when we start treatment. It informs what stage of the disease we are at.
Infection, so
And so it's very, very important that we get it done. We find that it's quite pricey, and so a lot of
usually,
people you ask to do it find that they skip it. But it's really, really important. And so if you had been diagnosed with hepatitis and your doctor had asked you to go and do a viral load, please go and do a viral load.
please do it.
Try and, regardless of how expensive, these things can make all the difference. So please, the viral load is very important. Okay, yeah. We were speaking about the panel as well.
Yes, so for the hepatitis panel, so there are various things you can look out for to make sure, okay, is it a chronic infection? Is it an acute infection? How infective are you? So this is what the panel can actually just tell us. Then sometimes even when you're immunized against it, you get your vaccines. If you check the panel, oh, was I actually vaccinated? Because some vaccines are not as active as we think. So if you want to make sure that your vaccination is actually quite potent, you can actually do this hepatitis panel.
Yeah, so that the panel would tell us. So there are different markers in the panel, but typically there are five that we are after that we focus on, and particularly the antibody. So now the antibody to the surface antigen will tell us that there's immunity. Now, the immunity could be due to vaccination or due to a previous
Infection.
infection. Yes, but what we find, we don't need to go into the details here. It's not,
Yeah.
we don't need all those details. But that panel will help us to distinguish between someone who had been immunized by a previous infection. We didn't mention earlier that there are some people who when they get the infection, move into an acute phase. Some move into some the body actually
Clears
clears
itself.
completely. So we're talking about hepatitis B and hepatitis C, but we're lumping it up together, even though there are there are so many differences that we don't really need to go into right now. But then it will help us to know whether the individual was vaccinated. For hepatitis B, there's vaccination. For hepatitis C, there's no vaccination. So this panel we're talking about is for hepatitis B. And so it will give us a clear picture of that to tell us how effective the person, how possible, how likely is this person to pass this infection to someone else, how long ago did this infection take place. Is it an acute infection? Is it something that has lasted much longer, depending on the types of antibodies that we see in that
In the
panel.
panel.
Yeah.
Okay.
Okay.
So some other tests we can do the imaging studies. So basically we can do an ultrasound. We can also do a CT scan. So as we said earlier from the examination, liver can be enlarged or it can actually be shrunken.
Yes.
So
So
doing this, that's subjective from the examination, but objectively, we can do the scans to actually make sure, oh, is it actually enlarged or is it shrunken?
or
Then
is
you,
it normal?
yes, is it normal? So that's
Yes,
still
also
possible.
because one very important reason why we do this scan as diagnosis is something that everyone who is diagnosed within a diagnosis is one of the tests that we need to do, we must do, is um, because we mentioned that there's a risk of progression to cancer.
Yes.
We can tell how the liver was at that. It gives us a baseline to work with so that we can compare it later, and then it helps us to diagnose um, malignant progression or
Okay.
cirrhosis or any other
Yes.
thing any other complication that may be taking place as a result, including ascites, um, whatever may be there.
Complications.
Yeah.
Okay. Then we can also have a biopsy. So this is just taking a small tissue from the liver. So this can actually just confirm some of the complications that we've said earlier, or if there's any ongoing inflammation, the degree of this inflammation can be confirmed by taking just that small tissue from the liver for a biopsy.
Yes, true. That's now. So when the of course, at this stage, you would already be seeing a specialist. Okay,
Definitely.
so of course, once we encourage everyone who is diagnosed to see a specialist. Well, at the least, once they see their doctor, these tests should be requested: the basic tests, the panel, the viral load, the liver function test, the full blood counts, of course,
Definitely.
and then the scan. So, where a biopsy is indicated is where we are suspecting that there may be some form of complications,
Complication.
of course, yes. So we don't do biopsies for everyone, but where we suspect that there's fibrosis, where we suspect that there is some other form of changes in the liver, or want to diagnose, or we see some suspicious nodules on the ultrasound, we go and we take a biopsy. So the biopsy is done by the gastroenterologist, by the specialist. Okay, and apart from the biopsy, of course, we could also do elastography. Elastography tells us how stiff. It tells us just a measure of the stiffness of the liver. So it helps us to in estimating how much fibrosis is going on. Basically, that's what it's doing, and fibro scans are done for that. So, yeah.
Okay.
Okay.
So if you're just joining us, today we are still talking about living with hepatitis. So we just finished the diagnosis, so we are going into the management of hepatitis. So for hepatitis A, so how do we usually manage that? I'm sure they don't want to know.
Oh, okay. So most of the cases of hepatitis A resolve spontaneously, and the body takes care of the infection. So mostly we give supportive treatments where there's dehydration, we correct the
Yes.
dehydration, yes, give fluids, and basically just support the body to fight the infection. And the body usually within 2 to 4 weeks in most of the cases would
Body
have,
fights it
would have
completely.
taken care of it. So we just recommend a bit rest, lots of fluids,
Definitely.
yes, and then whatever other supportive care may be needed in the course of the treatment, yes, in the course of the
Okay.
management, yes.
Okay.
Of course, it's important that we tell anyone who has that to avoid alcohol. So of course, we know that alcohol directly damages the liver, directly affects the liver. So alcohol is one big no for anybody
Yeah,
who.
hepatitis.
Yes, generally we even recommend the less alcohol, the
The
healthier.
better.
Yes, the better. Okay, so
Okay.
previously they used to recommend a glass a day, right, doctor?
Yes. Yeah.
But then these days there's really not much benefit. More studies are not showing that there's really any benefit from taking any alcohol at all. And so staying off alcohol is generally better for everyone, but specifically for anyone who's dealing with hepatitis,
You should
anyone,
avoid it.
avoid alcohol.
Okay. Then, so for hepatitis B, how do we go about that?
Okay, so generally, first and foremost, we must say that for managing all of these things, go to your doctor, go to the
First and
hospital,
foremost.
go to the hospital. Yes, don't seek counsel from someone else. I find that a lot of people tend to ask other people, and they say, "Oh, I heard that this thing is good for the liver, and so they gave me this thing, and I'm taking it." Or and by the time they are finally seeing you, they've done so much, and
That
eventually
worsens
they
it.
have lost a lot of time. They may have done some things that have been that actually injurious to the liver, further damaging the liver. So please don't take your counsel or your advice from other people. Take your counsel from your doctor. Please let it be find make it easy. Find a doctor that you are comfortable with, a good qualified doctor, a good hospital, and and get yourself checked immediately. So we recommend first of all that you get screened for
Hepatitis.
hepatitis. At least once in everybody's lifetime they should have done hepatitis
Yeah.
screening. Yes. So, but then at least yearly checks are fine. We recommend yearly checks. You do your hepatitis B screening, hepatitis C screening,
Yeah.
and then so if hepatitis B is negative, you get vaccinated immediately. Once you have a negative hepatitis B screening, please go and get
Vaccinated.
vaccinated. Yeah, we'll come to that later, but that is the basic thing you should do. And then hepatitis C, um, there's no vaccine, so of
Yes.
course you need to keep getting tested. So, depending on what stage we find the disease, if it's in an acute phase, if it's in a fulminant phase, a chronic
Chronic.
phase, so the care is actually individualized based on what we find for each patient.
Okay.
So there's no one size fits all
Management.
management plan. Yes. So basically, get to the hospital. There are drugs, there are antiviral drugs that we use at certain stages. Now, depending on what we find with the liver function test, a lot of the interpretations of these tests are quite technical. So but basically every GP should be able to take request these investigations, and where there is any form of derangement, refer to a specialist. So the specialist can take over from there and then initiate antiviral therapy as soon as is necessary. Now, initiating the antiviral care therapy early enough reduces the risk of progression to cirrhosis, reduces the risk of progression to liver cancer.
Awesome.
And so we can't say it enough. Once you have had a diagnosis of hepatitis at any point in your life, if somebody told you, please go. If you had not checked for a while, if you have not done anything about it, and I find that a lot of people have actually been told at one point and they have just let it go, or maybe initially they did a few tests and they said everything was fine and
That
they
was
let
the
it go to
end.
rest. Now there's a risk that somewhere down the line, what was a chronic illness infection can now um, begin to progress, and you will not be able to know that it is progressing till it has done all the damage that it is setting out to do. So please go and get checked. If you had not been checked, if you had not done if you had not been followed up since then, please go and request a follow up. Go to your hospital as soon as you can and get it done. So for we have the supportive care, there's antiviral care, antiviral therapy, which may, for hepatitis C, we give drugs for 3 months and then we are reassess the patient thereafter. So for hepatitis C, we can actually cure the infection. For hepatitis B, we may not be able to cure the infection, but it can be effectively managed with the antiviral drugs where it is indicated. But regular monitoring is important for
It's key.
everybody. It is very, very important for everyone. So um, please go and get checked and go and get treated if you need to. Okay. Yes. So for those of us just joining us once again, this is Limi Hospital. This is our um,
Instagram Live.
Instagram live.
Yes. And you can also join us tomorrow for our health walk where we'll be doing free screening and vaccination for hepatitis.
Yes, so please, okay, that's good. Please, so I'll call one or two of my friends who I know have been requesting screening to come and join. Please come and join us. Leave us in the central area.
Yes. Central
We'll be
Business
doing,
District.
yes, free screening for hepatitis and vaccination for people who are negative. Thank the Mini Hospital for that.
Okay.
Okay.
So now for prevention of hepatitis, how can we actually prevent hepatitis? The various forms.
Okay, so prevention. Generally, for it depends on the type of hepatitis virus. Of course, we mentioned that the A and E were transmitted in what we eat.
Yes.
So, of course, food hygiene, hand washing, hand washing, hand washing. We can't stress hand washing enough. Even though it seems so simple, but you don't know the thousands of diseases that are preventable by just
Just
washing your
washing your
hands
hands.
and washing them well. Yes. And so hand washing is cannot be overemphasized. Please don't rinse your hands and say you have washed them. Wash your hands with soap and water
Water.
and running water. Little demonstration. You rub the soap between your hands. You rub your palms together. Okay, do something like this. Wash the palm, wash the back of the hands, scrub your palms,
For long
you
periods
know,
of time.
your rinse, yes, your wrist. See all these things I'm doing. If you actually do them at least 30 seconds, you would have passed, and then you rinse in the same order. Do everything again and rinse. Just by rinsing, washing your hands well, we can
Prevent a
prevent a
lot.
lot, of this. And hepatitis A, hepatitis E are part of those. Even hepatitis B and C, of course, because like people who work within the hospital settings, you may get in contact unknowingly with some
With
of these
fluids, yeah.
fluids, and so importance of hand washing cannot be overemphasized. Universal precautions as well. Okay, yeah. So for B and C, we mentioned that they are transmitted through body fluids and blood. So of course, I mentioned earlier that we should make sure that we get safe blood products
Yeah.
where blood transfusion
Sean
is
is necessary.
necessary. So where we need blood transfusion, please, they must be got, blood products must be obtained from the right channels, from blood banks, and they must be screened. If you get it from one center and you bring it and it's already written,
They
please,
have
when
to
it gets to
rescreen again.
another, to the hospital, let it be rescreened, so that you are double sure that the products are safe. Okay, so safe sex practices. So the same way, I know a lot of talk is on about HIV and HIV transmission. Interestingly, hepatitis B, hepatitis C are transmitted the same way HIV is
HIV.
transmitted. So your ABCs are still very, very much in play. So safe sex practices, use of condoms, barrier protection, um, not sharing sharp objects, please. When avoiding use of needles, sharing needles, infecting drug abuse,
Yeah.
using
Razors, even razors.
even razors, please. So if you can get your own razors for the men, for your clippers, as much as possible, use yours, and then ensure that they are sterilized if you have to share. Properly sterilized if you have to share, but as much as possible, do not share sharp objects at all. You know, yes. So, so medical equipment, of course, for medical staff, anyone working in a medical setting, please, universal safety precautions. We are all aware of them. Um, Proper disposal of sharps generally in the hospital setting, use of sterile gloves, properly donning and doffing personal protective equipment is very important. Okay, so those are ways that we can prevent the infection.
Okay. So I know that we've mentioned the complications of hepatitis moving on, but can we just still just
Recap.
yes,
Okay, you
recap.
can tell us a little more.
Okay, so for the complications, liver cirrhosis is one of them. So basically, this is when the liver goes through scarring. So there's already scarring from this inflammation that is ongoing in the liver, and most cases there's already shrinkage. So that's when we said from the examination you may not feel the liver because at that point it has already just shrunken
And
because of
so
scarring.
in effect the functions of the liver will obviously
Definitely
be
be
affected.
deranged.
So the liver, like a healthy liver and all its functions, now the liver is shrunken, now the liver is fibrosed. There's a
Yeah,
lot of scar tissue that is
not there.
replacing the healthy liver tissue, and of course, by you know that the function of the liver will be greatly
Deranged.
impaired.
Okay.
So yeah,
So another complication is also the liver cancer. So that's the primary liver,
cell cancer.
yes, cell cancer, carcinoma. So basically, 80% of this is actually caused by either hepatitis B or C, actually.
Yeah.
So yes, that's
So
one of the
yes, so there are
complications.
other causes of primary. So now the liver is one organ that can have a lot of secondary
Spread.
malignant, yes, spread of cancers. But for primary liver cancers, cancers that are originating within the liver, 80% of them are caused by this viral hepatitis. So it doesn't. So we cannot even oversay it. A day like this is extremely important. So if we can just control hepatitis B and C, and the WHO actually aims at between among the SDGs, one of the targets is they're trying to have or in fact bring down the prevalence of hepatitis B and C and the new infections by 90% between
That's
2024, 2016 and 2030. So by 2030, we expect that we should have 90% less. I know that in Nigeria, we're not anywhere near that.
yeah,
A lot of people still have not even been tested even once. So we have a long way to go. But be that as it may, at least days like this help us to just
spread the word.
emphasize, yeah, spread the word and tell everybody why it's important to get tested, why it's important to get vaccinated. It is still very, very sad that so many people in the healthcare system today are not vaccinated. And I mean, they are seeing patients day in, day out. Please, if you're a healthcare worker, you have no reason. In fact, if you are working in a hospital, write it big on the wall. No healthcare worker should come to work this week if
Our
they haven't
vaccination.
they haven't started their vaccination process. And so for the other types, of course, the preventive methods that we have spoken about. So for the vaccination, now we need to talk about that,
Yeah.
right? So the good thing is that in the NPI, that's the National Program for Immunization, hepatitis vaccination, hepatitis B vaccination is incorporated. So every child who is born and who
Usually
gets their
gets.
vaccination from birth, they get, yes, they get vaccinated for hepatitis B. So you see that for most children and even many teenagers were vaccinated from birth for hepatitis B. However, the issue is with adults. So before that was not incorporated into the vaccination schedule, and so most adults, Nigerian adults that you see, have not actually been vaccinated, except so everybody who cannot remember likely doesn't have any, has not taken a vaccine, because you should remember. So it's a 3-dose vaccine that you will take today. If you take it today, if you start today, you take the second dose after a month, and you take the third dose after 6 months. So it's a 3-dose schedule that you should go through. So if once you have got your 3 doses, now like she was talking about, some people may get a vaccine and the vaccine is not effective. Things like a broken cold chain. Now, vaccines are supposed to be kept in a cold chain, meaning that they should not go below a certain temperature, regardless from the time of their production to the time that they are
Used.
administered to the person who is going to receive them. So, unfortunately, some vaccines pass the cold chain is broken somewhere, and so it may reduce the efficacy of the vaccine in generating that immune response to prevent the infection. So, but then if anyone, most people who have gone through the 3 doses will be vaccinated, will be immunized, will be immunized against hepatitis B. So please, if you have started your vaccination schedule and you hadn't completed, this is your cue to go back and go and continue it and finish it up. Okay, so for hepatitis B, please, hepatitis A also has a vaccination. Yeah, hepatitis A vaccination is available too. Please, we can also take advantage of that.
So one of the other complications, I think the end stage is definitely death.
Yeah,
So from the liver cancer, from the liver cirrhosis, it can actually progress and can lead to the death of a person.
yes, which
So
is why prevention
it's key.
is very, very
So
okay.
so do you have any questions for us? We've gone through everything. We've gone through how to actually find out if you have hepatitis, what hepatitis is, and also the management. So if you have any questions, you can actually send to our inbox. So if you actually have, so we have a question here. Someone is asking if they've been vaccinated for hepatitis and can they continue screening for it? Okay, so usually
I didn't get that.
okay, so you've gotten the vaccination for hepatitis B.
Okay.
So do you keep on screening for hepatitis?
Okay, so you don't need to keep screening for hepatitis once you have gotten vaccinated, because usually the vaccine protects from fresh infections. It is theoretically actually possible to still get infected, but usually from 5, 10 years and above, the efficacy begins to drop.
Okay.
The efficacy of the vaccine begins to drop. However, it doesn't, in most people, it doesn't drop to a level where they really need to be
Take it.
bothered. Yes, but
Okay.
so booster doses, maybe after 5 to 10 years, you could get a booster dose, but no, you do not need to go and keep on screening.
Screening.
Yeah. So, but then in any case, the screening should give us, there's a picture that we will expect to see if you do the full panel. But no, simple answer is no, you don't need to keep getting screened. Okay.
So any other questions, you can still send to the inbox. Okay. So we have a question. Can hepatitis B be spread through saliva and sweat? Since we mentioned bodily fluids, can they actually be?
So tell us now, Doctor.
Okay, so most time they are not actually spread through saliva and body sweat. So when we're talking about bodily fluids, you're talking about things like blood, things like semen, basically. So
Yeah,
those are the bodily fluids that we are really concerned about, and not sweat and also saliva.
yeah. So now hepatitis B actually is one of the most infectious viruses.
Yeah.
Like it is, I don't know how many times more infectious than HIV.
HIV.
Meaning that if a drop was to be left here and you went away and one had HIV and one had hepatitis, that one hepatitis B can be active on that surface for a much longer time. HIV will die sharp, sharp. They're very lazy and
I'm sure a lot of people don't know that.
yeah, to die, HIV will die off fast on that surface, but hepatitis B can stay there for hours. And so body fluids can transmit it. Saliva, it's actually found in saliva, but transmission in the saliva is not something that has been demonstrated. So it's not one of the means that we are very worried about. Yes, so.
So we are still expecting more questions. So another question, what is the best antiviral for hepatitis B?
What is the best
antiviral for hepatitis B?
Okay, so best is a big.
And you want to go into the technical aspects.
Yes, generally that aspect you should leave for your doctor to determine because, of course, the best treatment, like I said earlier, will be tailored to the individuals. However, commonly available ones we use commonly, tenofovir, which is one of the drugs that we use also for HIV. So where we have HIV and hepatitis co-infection, we would
That's a
prefer
good
to,
choice.
yes. Yeah, it's a good choice. So, but tenofovir is usually our first line where there's no kidney damage, other drugs, interferons, and the rest. Just leave that to the hepatologist, to the gastroenterologist who will select the drugs. But basic thing we need to know is that at a certain stage, some people with hepatitis will need to have the antivirals.
Okay. So we have another question. Any dietary advice for people living with hepatitis?
Okay, so generally, healthy eating.
I think alcohol.
Oh, number one, yes.
I know we said diet, but
that.
alcohol. Alcohol. Should be avoided.
Yes, so avoiding alcohol is important for everyone who has any form. Well, like I said earlier, this is one of the major things we say. If you come hypertensive, stop alcohol. If you come with cholesterol, we tell you stop alcohol. If you come with the cancer, we stop alcohol. So alcohol generally goes everywhere, but particularly to diseases that have to do with the liver, we don't want you to take alcohol. Um, other things, of course, eating a diet that is healthy, that's rich in fiber, so grains, brown rice, wheat, all of those fiber. We just want a fiber-rich diet. Now, we will not particularly be bothered about saying don't eat this, don't eat that, apart from a generally healthy diet, except in people who are already in who have a more advanced disease, where we may need to limit the amount of their salt, we need to limit their protein. Some of these things in the diet can tip them into encephalopathy, which is another form of.
And they can actually just see a dietitian that can just drop the specific things they can eat.
Yes. So, because of course, a lot of people will still have other things that they are dealing with in addition to this hepatitis. So, generally, see a dietitian if you need more specific dietary recommendations. So, but if it is just plain hepatitis and there's no sign of decompensation, there's no sign of a complication, a healthy diet is recommended.
Good to go.
It's a balanced diet. Okay.
So we have a question here. Is there a cure for hepatitis B?
So we mentioned earlier that we have a cure for hepatitis C. We have management for hepatitis B. Okay. In some cases, however, like we mentioned before, there are some people who are actually cleared completely, whom the infection is completely cleared. But yes, there are treatments for hepatitis B. And there's a cure for hepatitis C. Okay.
Then another question: can viral hepatitis be treated?
Oh yes, we've mentioned that. I think we've answered that already. Okay, so keep the questions coming. This is Lini Hospital. This is Dr. Alofe. This is Dr. Keshy.
Yes. If you're just joining us, we are discussing living with hepatitis. Okay, so we have another question here. Will herbal natural remedies, supplements, or vitamins control hepatitis B infections?
No, no, no. They do not control hepatitis B infection. First of all, we don't be careful with herbal remedies because what you're trying to treat, you're trying to use to take care of the liver may actually be damaging it. So please run every herbal remedy, every supplement you want to take by your doctor. Okay, very, very importantly. Now, there are some particular vitamins, amino acids that we recommend as adjuncts, or like we use them in conjunction with whatever we may be using to treat a patient with hepatitis. But let them be prescribed by your doctor, and they should not replace antiviral care. I notice a lot of the time that people may just go on these drugs. So many of them, Livolin, a lot of them,
Mm.
their names are not coming to my head, and people just believe that that is the treatment. They are not the treatment for hepatitis. Please, it's very important to note that they are just to help. They just like adjuncts because they identify some of the amino acids that are important for the liver and that will help in the process of the healing, but they are not the treatment.
Okay. So we have another question. Someone is asking, so I started my vaccine series, but I did not complete my second and third dose. Do I have to start over?
Okay, so if you have completed your vaccines and if you have started and you haven't completed, just go back and continue for where you stopped. Okay, so because it's a three vaccine series and um, a lot of people may not complete. This is a very common
Yeah.
question that people have. So if you have stopped, for example, you took the first dose and when you forgot, you missed the appointment for the second, or you took the first two, because those first two are easier to remember, they're just four
Six
weeks
months
apart.
later.
But that 6 month dose, a lot of people tend to
Yeah.
forget. Just go back to the hospital and continue from where you stopped, meaning just go and take that third dose.
Okay.
Now, what we would do, what should be done is that after the third dose, at least from 4 weeks and above, after that third dose, we can do an antibody level to check how much of the antibodies you have developed. Okay, so there's a range within which we know that it is still okay. Okay, typically, if you are fully vaccinated, it should be above 100. If you are partially about 10 to 100 is still acceptable.
Acceptable.
Anything less than 10, your body has not, you really need to repeat the whole schedule. So,
Okay.
but for most people, just go and continue and
That's
finish
enough.
up. Yes, wherever you stopped, finish up. Then thereafter, we can test the levels and be sure that you're okay.
Okay. So we have another question here. Should I get the hepatitis B vaccine if I have a chronic hepatitis B virus infection or have recovered from a past infection?
No, you don't need
Yeah,
to.
unfortunately.
So the vaccine is for prevention. The vaccine is not for treatment. So if you're already having a chronic hepatitis B infection, it has no value.
Yeah.
It won't do anything. And then if you um, have recovered, your body has developed natural immunity to it. So that's not necessary also.
Okay. So we're still expecting more questions.
Okay.
So question here. I'm diagnosed with chronic hepatitis B. Can I get married and have children?
Okay.
Okay, so getting diagnosed with hepatitis B, as we said, is not a death sentence. You can be managed adequately, and the viral load can actually be decreased. And even getting married is not a problem. Then having children. So we said children are usually vaccinated from birth now, is already part of the schedule. So within 24 hours, most children are already vaccinated. And if there's an exposure in this case, they give something called the immunoglobulin. So that is even conferring more immunity for the child just to prevent this transmission of
Yes,
the
so
virus.
very, very correct. So a lot of people we see come and they are doing their premarital testing, and then one partner finds out that there's hepatitis B, and they begin to say, "Oh, are we going to continue with the marriage? You can go ahead and get married." So all we would advise, for example, someone who is planning to get married, and you find out that your partner, potential partner, has hepatitis B, just the other person who should go and get tested. If the person comes out negative, they should go and get the full
Vaccinated.
vaccination. So once they have got their 3 doses, they are fully immunized, and wedding can go on as
Yeah.
planned. Now for the children, like we said, you can have the children. So far, you have so every part of our in the antenatal guidelines is that hepatitis testing is done for every pregnant woman.
Yeah.
So every pregnant woman in Nigeria gets tested or should get
Pregnancy.
tested for hepatitis B, hepatitis C. Now, where hepatitis B infection is identified in pregnancy, we'll do the normal things. You go ahead and do the liver function test. And one important thing is that sometimes we may focus on the baby and forget about the mother.
Mother.
So I had seen one person who somewhere had been diagnosed with hepatitis B in pregnancy, and she said she just forgot about it. And by the time uh, she was being seen much later, it was now cancer.
Wow.
Yes, they just did a scan. In fact, the scan was for something else, and there was, so that those are very painful cases because it was actually found out, and she did everything to prevent her baby from getting it, but after the delivery, forgot to come back for her
Follow up.
own follow up. So it's very, very important. That's a very painful case, but very, very important that um, we do not take the mother for granted. So the baby gets vaccinated, like she said, immediately the baby is born, and the baby gets the hepatitis B immunoglobulin. So the moment that diagnosis is made in pregnancy, your doctor will inform you to go and get it, to go and find out how much the immunoglobulin is, because it may be quite expensive, but it is invaluable. You cannot joke with it. So immediately that baby is born, that same day baby gets that immunoglobulin. That immunoglobulin is what protects the baby. The vaccine that we are giving the baby is what will give the baby. So there are two types of immunity: the passive and the active.
Active.
So that vaccine we are giving the baby, the 3 doses, will give the baby active immunity against future infections. But the baby is already exposed to the mother's own infection at birth. So that immunoglobulin we give them protects them and helps to prevent them from getting. And so it is a tragedy that shouldn't happen for any baby to um, get to have mother to child transmission of
Transmission.
hepatitis B,
Yeah.
because it is fully preventable.
Yes.
Yes.
Okay. So I think we have one more question here. Does alcohol cause hepatitis or any form of pharmaceutical drugs?
Okay, yeah, sure. There's
Toxic.
alcoholic. When we talked about from the beginning, we mentioned that hepatitis is not only caused by viral causes, that there are chemical or
And
toxic causes.
toxins.
Alcohol is one of the top causes. Drugs, of course, are very important causes as well.
Okay. So we still have the question. I'm currently pregnant and I have hepatitis B. What should I do to protect my baby?
I think we've run through that,
Yeah, I
right?
think we've gone through that. So in the pregnancy, just make sure you take care of yourself basically. Then in delivery, there are some steps we actually take to prevent sharing of these bodily fluids during delivery. Then afterwards, the immunoglobulin, the vaccination for the baby. And I think, yeah, the baby should be fine with that. So, can I donate blood if I have hepatitis B?
No, no, no,
Yeah.
no, no,
So
no.
that's
There's no
putting,
place for that.
yeah, you're putting the recipient at risk. Okay. There's a question here. I'm in love. When and how do I tell my prospective partner that I have hepatitis B?
Tell them as soon as possible, because they can get back. It's not HIV we're
Yeah,
talking
it's not a
about.
death sentence. It's not.
Even though HIV too, you should tell them. But here we're talking about hepatitis B. You have no reason to hide it from them. Let them know so that they can get vaccinated early enough, so that it's not maybe when you're planning the wedding, 1 month the
Yeah.
wedding, and they have to go through a 6 month course for the vaccination. Tell them immediately, the relationship is going
Yeah.
somewhere.
And they can still come to the hospital afterwards. Then they will get screenings, counseling.
Yeah.
Definitely, that's going to be part. Then there's another question. If I have chronic hepatitis B infection, can I hug my children, partner, or friend? So,
Of course,
it's
it's not spread by hugging. It's not
yeah.
spread by casual contacts. Like we said, body fluids, even saliva and all, even sweat can carry the virus, but the chances of it being transmitted by those means are
Routes.
very, very minimal. and certainly not by hugging, certainly not by
Definitely not.
by holding hands, certainly
Yeah.
not by all of those.
Yeah.
Yes.
Okay. So, if hepatitis B is sexually transmitted, how come my partner is not infected?
Okay, so various reasons can. What are reasons? Possible reasons
Okay.
that you
So,
think for that?
in some cases, the partner, okay, if you're using protective means during sexual intercourse, definitely, then vaccination. Your partner may be vaccinated against hepatitis B. So the spread actually, then the viral load. So as I said earlier, I think from the panel, you can find out how infective you are. So the infectivity level can actually be detected from the panel. So some people are not as infective as some.
Yeah.
So that can actually be a factor.
So the stage of the disease that
Yeah.
the person who is infected is at
Yeah.
it also determines how effective that
Yeah.
they are.
And the
So
amount of the
those
virus
are
also.
several reasons why.
Yeah.
Okay,
So
I think well,
yes, we've come to the end of this. I think we've celebrated World Hepatitis Day well.
yes,
Okay, one last question. Where can I get vaccinated against hepatitis B? So you can come tomorrow to our health walk. We are having a health walk in our branch in Central Business District. There's going to be free screening for hepatitis B, and we're going to be having vaccinations for that. So you
yes,
can just come through tomorrow morning.
yes,
Yeah.
yes. So please,
Join us for
join
our
us.
health walk
Yes, the
tomorrow.
health walk is good. We're talking about promoting a healthy lifestyle.
Yeah.
So healthy lifestyle. A lot of us struggle with regular exercise. But I find that when I come for those walks, I get motivated. So
Definitely.
it's really good to come. So come join us. We'll walk around the central area with music and we have
So
fun
much fun.
together.
So much fun.
So it's 7 a.m. in the Hospital Central Business District. Yes.
Thank you very much. So join us again for another exciting Instagram Live next week, same time, 6 p.m. So
Thank you.
thank
Thank you very
you.
much. Bye bye.
Bye.